আজ আমরা এই ভিডিওতে কার্ডিওভাস্কুলার সিস্টেমের কিছু এমসিকিউ সম্বন্ধে জানব। ফার্স্ট হচ্ছে স্পেশালাইজড কার্ডিয়াক মাসল আর প্রেজেন্ট ইন ড্যাশ লেয়ার অফ দ্য হার্ট। অপশন এ এপিকার্ডিয়াম, অপশন বি মায়োকার্ডিয়াম, অপশন সি এন্ডোকার্ডিয়াম, অপশন ডি পেরিকার্ডিয়াম। কারেক্ট অ্যান্সার হচ্ছে অপশন বি মায়োকার্ডিয়াম। Second number, one of the organ located in the mediasternum is the option A cerebellum, option B heart, option C stomach, option D uterus. Correct answer হচ্ছে option B heart. Third number, posterior surface of the heart is formed by option A right atrium, option B left atrium, option C left ventricle, option D right ventricle. Correct answer হচ্ছে option B left atrium. Fourth number, coronary sinus opens into option A inferior vena cava, option B right atrium, option C left atrium, option D great cardiac vein. Correct answer হচ্ছে option B right atrium. Fifth number, what is the normal amount of pericardial fluid? Option A 5 to 10 ml, option B 20 to 50 ml, option C 50 to 100 ml, option D 100 to 200 ml. Correct answer হচ্ছে option B 20 to 50 ml. Sixth number, cardiac muscle differs from skeletal muscle by option A it is an involuntary muscle, option B it has automaticity, option C it has conductivity, option D all of the above. Correct answer হচ্ছে option D all of the above. Seventh number, the heart valve are lined by dash layer of the heart. Option A epicardium, option B myocardium, option C endocardium, option D pericardium. Correct answer হচ্ছে option C endocardium. Eighth number, valve between left atrium and left ventricle is option A bicuspid valve, option B tricuspid valve, option C tetracuspid valve, option D monocuspid valve. Correct answer হচ্ছে option A bicuspid valve. Ninth number, valve between right atrium and right ventricle is option A bicuspid valve, option B tricuspid valve, option D tetracuspid valve, option D monocuspid valve. Correct answer হচ্ছে option B tricuspid valve. 10th number, mitral valve is also known as option A bicuspid valve, option B tricuspid valve, option C tetracuspid valve, option D monocuspid valve. Correct answer হচ্ছে option A bicuspid valve. 11th number, which valve present backward flow of blood into the left atrium? Option A aortic valve, option B pulmonary valve, option C tricuspid valve, option D mitral valve. Correct answer হচ্ছে option D mitral valve. 12th number, tricuspid valve is located between option A aorta and right atrium, option B left atrium and left ventricle, option C right atrium and right ventricle, option D right ventricle and pulmonary artery. Correct answer হচ্ছে option C right atrium and right ventricle. 13 number, responsible for murmurs which auscultate at the second left intercostal space along the left sternal border is option A aortic, option B bicuspid, option C pulmonic, option D tricuspid. Correct answer হচ্ছে option C pulmonic. 14th number, the closure of the aortic valve in the arterial waveform is denoted by option A anaerobic notch, option B dicrotic notch, option C systolic notch, or option D end of diastolic point. Correct answer হচ্ছে B dicrotic notch. 15th number, coronary sinus is guarded by option A crista terminals, option B Thebesian valve, option C mitral valve, option D spiral valve. Correct answer হচ্ছে option B Thebesian valve. 16th number, the arteries that supplies the heart muscle are branch of the option A abdominal aorta, option B thoracic aorta, option C aortic arch, option D ascending aorta. Correct answer হচ্ছে option D ascending aorta. 17 number, potential anastomosis seen in option A labial branch of facial artery, option B intercostal artery, option C coronary artery, option D arterial assets of মেসেন্ট্রি। কারেক্ট অ্যান্সার হচ্ছে অপশন সি করোনারি আর্টারি। 18 number, identify the artery that carries deoxygenated blood. Option A umbilical artery, option B pulmonary artery, option C both A and B, option D carotid artery. Correct answer হচ্ছে option C both A and B. 19 number, blood supply to the heart is maintained by option A pulmonary, option B coronary, option C aorta, option D myocardial. Correct answer হচ্ছে option B coronary. 20 number, posterior communicating artery is branch of option A internal carotid artery, option B external carotid artery, option C middle cerebral artery, option D posterior cerebral artery. Correct answer হচ্ছে option A internal carotid artery. 21. Which of the following is not a branch of first part of maxillary artery? Option A great palatine artery, option B middle meningeal artery, option C deep auricular artery, option D inferior alveolar artery. Correct answer হচ্ছে option A great palatine artery. 22. Left coronary artery supplies all except option A anterior 2/3 of intraventricular septum, option B posterior 1/3 of intraventricular septum, C left ventricle, D apex of heart. Correct answer option B posterior 1/3 of intraventricular septum. 23. Right coronary artery supplies all except A apex, option A apex of heart, option B intraventricular septum, option C intraatrial septum, option D SA node. Correct answer option A apex of heart. 24. Pacemaker of heart is option A AV node, option B SA node, option C Purkinje fiber, option D parasympathetic system. Correct answer option B SA node. 25. Which of the statement is true regarding heart contraction? Option A the intercalated discs allow the atria and ventricles to connect together stimulously. Option B the sudden influx of potassium into myocytes triggers depolarization. Option C the pressure and volume changes in the heart stimulate heart contraction. Option D ventricular systole occur following depolarization of the ventricles. Correct answer option D ventricular systole occur following depolarization of the ventricles. 6. The pacemaker of the heart is the A Purkinje fiber, B bundle of his, C atrioventricular node, option D sinoatrial node. Correct answer option D sinoatrial node. 27. SA node is located in option A in the wall of right atrium, option B in the wall of left atrium, option C in the wall of atrioventricular septum, D in the wall of ventricular septum. Correct answer option A in the wall of right atrium. 28. Slowest conduction is in option A SA node, option B Purkinje fiber, option C AV node, option D bundle of his. Correct answer option C AV node. 29. Distension and recoil of blood vessel during systole and diastole is achieved through the dash property of blood vessel. Option A peripheral vascular resistance, option B elasticity, option C diameter, option D smooth muscle contraction. Correct answer option B elasticity. 30. Vasoconstriction leading to increased blood pressure is triggered by the following situation. Option A stimulation of the parasympathetic nerve supply, option B stimulation of the cardioinhibitory center in the medulla, option C increased level of angiotensin 2 in the blood, option D increased level of carbon dioxide in the blood. Correct answer option C increased level of angiotensin 2 in the blood. 31. Baroreceptor help in option A stimulating respiration, option B stimulating sweating, option C maintaining BP, option D stimulating thrust. Correct answer maintaining Option C, maintaining BP. 32. Arterial supply to SA node is by option A, left anterior descending coronary artery, option B, posterior interventricular artery, option C, left coronary artery, option D, right coronary artery. Correct answer option D, right coronary artery. 33. Sympathetic supply to the heart, option A, C5 to C7, option B, T1 to T4, option C, C1 to C4, option D, T5 to T9. Correct answer option B, T1 to T4. 34. The coronary sinus, option A, lies in anterior part of the coronary slushes, option B, end in right atrium, option C, has vena cordis minimi as its tributaries, option D, develops from right anterior cardinal vein. Correct answer option B, ends in right atrium. 35. The arterial supply of the bundle of his is option A, intraventricular branch of left coronary, option B, intraventricular branch of right coronary artery, option C, marginal, option D, right aortic sinus. Correct answer option B, atrioventricular branch of right coronary artery. 36. Which is true about arch of aorta? Option A, start at third right ICS and ends at left third ICS. Option B, left vagus arch over it. Option C, lies behind body of sternum. Option D, it is closely related to parietal pleura. Correct answer option D, it is closely related to parietal pleura. 37. Stimulation of vagus nerve result in option A, increase in heart rate, option B, decrease in heart rate, option C, dilation of bronchioles, option D, dilation of coronary artery. Correct answer option B, decrease in heart rate. 38. Most common cause of hypertension is option A, renal artery stenosis, option B, essential hypertension, option C, phenochromoscytoma, option D, chronic glomerulonephritis. Correct answer option B, essential hypertension. 39. Normal cardiac output in a healthy adult is option A, 1 liter per minute, option B, 3 liter per minute, option C, 5 liter per minute, option D, 7 liter per minute. Correct answer option C, 5 liter per minute. 40. Time duration of cardiac cycle is option A, 0.5 second, option B, 0.8 second, option C, 1 second, option D, 2 second. Correct answer option B, 0.8 second. 41. The blood circulation that is responsible for gas exchange between alveoli and capillaries resulting in the oxygenation of blood is the option A, coronary circulation, option B, hepatic circulation, option C, pulmonary circulation, option D, systemic circulation. Correct answer option C, pulmonary circulation. 42. Blood from the right side of the heart flows into the option A, superior vena cava, option B, pulmonary tank, option C, pulmonary vein, option D, aorta. Correct answer option B, pulmonary tank. 43. The amount of blood that is ejected from the left ventricle in one contraction is called the option A, cardiac output, option B, stroke volume, option C, preload, option D, afterload. Correct answer option B, stroke volume. 44. Cardiac output can be calculated using option A, cardiac output equal to tidal volume into heart rate, option B, cardiac output equal to tidal volume into peripheral vascular resistance, option C, cardiac output equal to peripheral vascular resistance into heart rate, option D, cardiac output equal to stroke volume into heart rate. Correct answer option D, cardiac volume equals to stroke volume into heart rate. 45. What is the source that you might suspect if bright red blood is backflowing into the tubing of an intravenous drip? Option A, capillary blood, option B, venous blood, option C, arterial blood, option D, peripheral blood. Correct answer option C, arterial blood. 46. The venous blood from organs of the digestive system such as the stomach and intestine will drain into the Option A portal vein, option B mesenteric vein, option C internal iliac vein, option D lumbar vein. Correct answer option A portal vein. 47. Oxygen is carried by blood after it is combined with option A albumin, option B WBC, option C hemoglobin, option D platelet. Correct answer option C hemoglobin. 48. Baroreceptor control option A blood pressure, option B atrial oxygen tension, option C SpO2, option D stroke volume. Correct answer option A blood pressure. 49. Normal cardiac output is option A 1 to 2 liter per minute, option B 3 to 4 liter per minute, option C 5 to 6 liter per minute, option D 7 to 8 liter per minute. Correct answer option C 5 to 6 liter per minute. Question number 50 and last question. What is preload? Option A pressure in the ventricle at the end of systole, option B pressure in the ventricle at the end of diastole, option C pressure in the aorta at the end of systole, option D pressure in the atria at the end of systole. Correct answer option B pressure in the ventricle at the end of diastole.